Ultrasound OB/GYN Vocabulary Quiz Part 5. Heterotopic pregnancy. The presence of multiple gestation, with one being present in the uterine cavity and the other outside the uterus. Retroflexed, a backward angle of the uterine fundus in the relation to the cervix. Menorrhagia, abnormally heavy or prolonged menses. Hydrops tubi profluens. Watery discharge, sometimes present with fallopian tube carcinoma. Tubo-ovarian abscess. Infection found in the late stage of pelvic inflammatory disease, resulting in the inability to differentiate tubal and ovarian structures. Theca lutein cyst. Multiple ovarian cysts due to abnormally high level of hormone HCG. Nuchal translucency. A test measures the nuchal fold thickness. This is an area of tissue at the back of an unborn baby's neck. Toxemia of pregnancy. When pregnant women have hypertension, proteinuria, edema, and a headache, this condition also known as preeclampsia. Hypovolemic volume. Shock due to decrease in blood volume. Annular placenta. A placenta in the form of a band encircling the interior of the uterus. Nuchal cord. When baby's umbilical cord becomes wrapped around their neck in womb. Bruce mole. A rare condition in which a large maternal blood clot separates the chorionic plate from the villus chorion. Dextrocardia. A congenital heart defect in which apex of the heart points to the right. Talipes. Abnormal position of fetal foot and ankle. Biophysical profile. Monitoring of fetal activity to include breathing movements, discrete movements, tone, and fluid surrounding the fetus accompanied by NST. Oligohydramnios. Low amniotic fluid. Brachycephaly. The shape of skull is shorter than the average. Multifactorial, involving several defect factors. Decidua basalis. Portion of the uterine lining that forms the maternal portion of the placenta. AMA, advanced maternal age. A woman 35 years of age or older. Cervical polyp. Finger-like growths on the surface of cervical canal. Hyperemic, increase of blood flow. Tubo-ovarian complex. An inflammatory mass involving the fallopian tube, ovary, and occasionally the other adjacent pelvic organs. Salpingitis, infection of fallopian tube. Ovarian reserve, estimation of the quantity and quality of women's remaining follicles.